my name is Lacey, and I'm just going to be explaining a little bit more about the condition your baby has. So, all babies are born with a natural hole in their heart that is called the fossa ovalis, and usually this hole closes before birth, but in some cases it does take a little bit longer, which is essentially what atrial septal defect is, or commonly called ASP. Um, it is the third most common defect, and so it's actually a little bit more common than you may think. And what happens is oxygenated blood and deoxygenated blood are usually separated in two separate chambers, but in this case there's a hole in between those two chambers, so oxygenated blood and deoxygenated blood mix, and this prevents the heart from working as well as it could. So in addition, your baby might experience some shortness of breath, some fatigue, some swelling of the lower extremities, so like the legs and the feet, some heart palpitations or heart murmurs. To confirm this diagnosis, we're going to do a chest x-ray and an echocardiograph, which is basically just an ultrasound of the heart. We'll also do an ECG, so this is going to look at the electrical activity of your baby's heart, just to confirm this diagnosis. The hole could close on its own, but at this age it's not very likely. Medications can help manage like the side effects that your baby might experience, but essentially it can't close the hole. So surgery is an option. Cardiac catheterization is when a small little device is permanently implanted in the heart, and it just closes up this hole and prevents any oxygenated blood from mixing with deoxygenated blood. So we can talk a little bit more about that, and if that's something you're interested in. Do you have any questions for me?